Welcome all. So the next topic of discussion is a chromosome aberration. So chromosomal aberrations are the abnormalities in the chromosome number or the structure. So chromosomes, we have seen the structure of the chromosome in the last session. So this chromosome can have abnormalities either in the structure of the chromosome or they can be in the number of the chromosomes. Okay, so they are classified as a numerical abnormalities or the structural abnormalities depending upon where is the problem. Numerical abnormalities, that is the change in the number of chromosomes. Structural abnormalities, that is the change in the structure of chromosome. Okay. Now, what do we mean by numerical aberration? That is the gain or loss of whole chromosome. Okay. Then usually due to non-disjunction. This non-disjunction also we have seen how this happens. Okay. So this can be aneuploidy, where there is a trisomy or monosomy. Trisomy means one chromosome is additional. So it will have 2n plus one extra chromosome, which is seen in Down syndrome, where there's an extra 21 number of chromosome is an extra. While monosomy X, where there is a 2n minus 1 composition, that is the 45X. Okay, that is seen in Turner syndrome. Okay, so these are the examples of aneuploidy. These are the numerical aberrations. Okay, so next aberration is a polyploidy. So what happens in polyploidy? The number of set itself gets more. Okay, so it may be triploidy. Normally we have a diploid chromosomes. Then here in triploidy there will be 3n, that is 69 chromosomes. In tetraploidy there will be 4n, that is 92 chromosomes. Usually this is incompatible with life. So polyploidy will be incompatible with life. Causes will be non-disjunction during the meiosis, okay, and advanced maternal age. So these are the causes for this. Then clinically you get a Down syndrome, trisomy 21, that is a numerical abnormality, aneuploidy. Turner's we have seen, Klinefelter also we have discussed how this non-disjunction happens, okay. Now the structural aberration, that is the change in the chromosome structure due to the breakage or rearrangement. Here the structure of the chromosome is hampered. So it may be deletion, that is the loss of chromosome segment. So 5p deletion is seen in cried-U chat. Okay, remember 5d deletion, cried-U chat is there. In duplication, that is the repetition of the segment leads to the extra genetic material. So here, if you see this one chromosome, here this particular segment is duplicated. That is the duplication of the duplication type of aberration. Then deletion. This particular segment is deleted and you get some short chromosome. This was the longer chromosome. This is the short chromosome. Then inversion. So if you see this particular part, which is shown yellow and this blue, will have change in its place. Okay, this is called as inversion. Okay, then next is a translocation. So what happens in the translocation? Here, this particular part will get shifted here. So this happens between the two non-homologous chromosome. Okay, so this will happen in the between the two non-homologous chromosome, that is the translocation. Okay, this is also mechanism which is seen in the Down's syndrome. Okay, so reciprocal. So this translocation can be reciprocal, where there is an exchange between the chromosomes, or it can be Robertsonian, where a fusion of acrocentric chromosomes is there. Okay, so in Robertsonian translocation, there is a fusion of acrocentric chromosomes. Now here you have one acrocentric chromosome. Here there is one acrocentric chromosome, and there is a fusion of these two acrocentric chromosome, and you get this a large metacentric chromosome. Suppose this part is getting joined with this, and you get a large metacentric chromosome, and here you will get a small chromosome. So Robertsonian translocation mutation. Reciprocal translocations are an exchange of maternal material between the non-homologous chromosome. So this Robertsonian translocation happens between the non-homologous chromosomes. So this Robertsonian translocation, there is a Down syndrome risk. Okay. Then inversion. We have seen inversion. Inversion is of two types. Here there is a inversion. Okay. So this part is getting inverted. So this is not involving the centromere. Sometimes if this involves the centromere, this part, then there are two different subtypes. Okay. The one which does not involve the centromere, that is paracentric. It does not include the centromere. So in inversion, the centromere is not involved. Next is a pericentric, it includes the centromere. Okay. Then next is a ring chromosome, where the ends of the chromosome will fuse and it will lead to the circular chromosome. Next aberration is a isochromosome, that is the mirror image arms. Okay, it is seen in some Turner syndrome variants. Okay, that is isochromosomes. Okay. Then what is the difference between the numerical and structural? In numerical, there is a number of the chromosomes are changed, while in structural, there is a change in the structure. For numerical, non-disjunction is the mechanism which is responsible. Here, the breakage is the mechanism which is responsible. In numerical, you have the example as a Down syndrome. Here, the mechanism is deletion, translocation, etc. And severity is often severe if there is a numerical involvement, while structural, the severity will be variable. Okay. So key mechanisms, non-disjunction leads to the numerical aberration, breakage and faulty repair will lead to the structural aberration. Okay. So the Down syndrome, most common trisomy. Turner is the only monosomy which is compatible with the line. Okay. Then acrocentric chromosome, most commonly involved in translocation. Structural abnormalities, you will get variable phenotype. Okay. Then numerical will have number problem, structural will have arrangement problem, trisomy will have one additional chromosome, monosomy will have one less chromosome, and translocation will lead to the exchange between the two non-homologous chromosomes. So that finishes the chromosomal aberrations. We have few SBA questions. Doctor, can you please try? Dr. Sansi or Dr. Monica, who wants to try?
Yes, sir.
Yeah,
Which
go
of
ahead.
the following is structural chromosomal aberration? Trisomy 21, monosomy X, polyploidy, deletion, mosaicism. Monosomy, deletion.
Deletion, correct. Cradhu-Chatt syndrome. Okay, deletion. Okay, chromosomal abnormalities are either numerical or structural. Numerical, you have trisomy, monosomy, polyploidy. Structural, deletion, duplication, inversion, translocation. In deletion, there is a loss of chromosomal segment. Okay. Next.
A neonate presents with high-pitched cry, microcephaly, and developmental delay. Which chromosomal aberration is most likely? Sir, option C, deletion, Cradhu-Chatt syndrome.
Yes. So option C is deletion. Classic Cradhu-Chatt syndrome, deletion of short arm of chromosome 5, that is 5p. Okay, short arm. Okay, deletion leads to the loss of genetic material, that is a severe phenotype. Next.
A woman is found to have balanced translocation on karyotyping. Which of the following is true? She will always be phenotypically abnormal. There is loss of genetic material. There is gain of genetic material. She may be phenotypically normal but have affected offspring. It always causes miscarriage. Sir, option D. She may be phenotypically normal but have affected offspring.
Correct. She may be phenotypically normal, so but have affected offspring. Balanced translocation, that is no net gain, no loss. Often asymptomatic, but risk of unbalanced gametes is always there. So that will lead to the miscarriage or abnormal child. Okay. Next.
Which chromosomes are most commonly involved in Robertsonian translocation? Sir, sex chromosome, option D.
Option is it?
D.
I have mentioned Robertsonian.
Option, any random chromosome can be done, na, sir?
No, Robertsonian is seen in acrocentric, no? So which are acrocentric chromosomes? Which are acrocentric?
Option C. Option
Option
C.
C, 13, 14, 15, 21. Okay. So you see
Yes.
the 21, no? Robertsonian Downs is there, no? So this
Yes.
will give to the clue. There is no other 21. Okay. So chromosomes 13, 14, 15. This happens in the acrocentric chromosome. This is very typical. Okay. So Robertsonian translocation involves acrocentric chromosomes. Common is a translocation between 14 and 21. That is familial Down syndrome. Next.
Which of the following correctly differentiates paracentric and pericentric inversion? Paracentric involves centromere, pericentric does not. Pericentric involves centromere, paracentric does not. Both involve centromere, neither involve centromere, both involve telomeres only. Option A, paracentric involves centromere, pericentric does not. Sir, option B, pericentric involves centromere and paracentric does not.
Correct. So pericentric around the centromere. Okay. So it will involve the centromere, while paracentric away from the centromere. So it does not involve. So option B. Okay. Pericentric involves the centromere. Okay. So paracentric inversion does not include centromere. Pericentric inversion includes centromere. This is important for gamete abnormalities during meiosis. Next.
Which of the following best describes a duplication chromosomal aberration? Loss of chromosomal segment, exchange between chromosomes, reversal of chromosome segment, extra copy of chromosomal segment, fusion of two chromosomes. Sir, option D, extra copy of chromosomal segment.
Yes, extra copy of chromosome segment. Duplication leads to the increased gene dosage. It may lead to developmental delay, congenital abnormalities, and less severe than the deletion. So, in summary, deletion subtype may be terminal or interstitial. There is a loss of segment. Duplication, it may be tandem or diplex. There is an extra segment. In inversion, it may be paracentric or pericentric. In paracentric, centromere is not involved. In pericentric, includes the centromere. Translocation, there is a reciprocal translocation where exchange between the chromosomes. Well, in Robertsonian, there is a fusion of acrocentric chromosomes. So take home message is that deletion, most severe cases because of the loss of genes, balanced translocation, normal phenotype but abnormal offspring risk. Okay, Robertsonian will happen in the acrocentric chromosomes, that is 13, 14, 15, 21, 22. Pericentric inversion involves centromere. Duplication leads to the gene dosage effect. Okay, so that finishes the chromosomal aberration. Thank you.